I want to start by highlighting very briefly the work of 6 other faculty members and committee members, all of whom are here and also in the audience today, and would, I'm sure, welcome the opportunity for further discussions at the breaks or after the conference. First, the work of Peter Wright, who you already heard from this morning, discussing the measles vaccine. Peter's own research has involved a detailed examination of the function and integrity, ontogeny of the mucosal immune system. His recent work has included a study with Margie Ackerman on sustained antibody responses after COVID, and the discovery that induction of IgM and IgA binding antibodies occur independently. You'll hear about some of his research on mucosal immunity to polio in Lizzie Brickley's talk. Cody Meissner, also here, professor of pediatrics, focuses on vaccine safety, clinical trials, and evaluation of new vaccines. This is his recent New England Journal review on the roles of FDA and CDC in vaccine safety. And also you'll see here a commentary last month on active and passive RSV immunization. Cody serves on the U.S. Vaccine and Related Biologics Products Advisory Committee, a mouthful, it's called VRBPAC, which makes recommendations to the FDA on licensure of new vaccines. This committee's been very, very busy and much in the news these last 2 years. Kendall Hoyt, your morning moderator, focuses on vaccine development campaigns and pandemic preparedness in her roles at the Dickey Center. Also at Thayer and Geisel. She led the vaccine task force for the COVID Commission planning group and has co-authored this comprehensive 2023 monograph shown on the left here, which covers the COVID pandemic from its origins right up through Operation Warp Speed. She's also a collaborator with Chris Snyder on the design of economic incentives for epidemic and pandemic preparedness. Chris Snyder is the Hyatt Professor of Economics here and leads a group analyzing the economics of vaccine development. They've shown that substantial savings would accrue from pre-pandemic investment in vaccine production capability. This would be achieved through so-called pull funding, shown in this lower abstract title, in which the government provides advance payment, advance purchase agreements as incentives to fully develop, license, and sometimes stockpile vaccines. If pull funding had been in place before COVID, the benefits of large-scale public funding for vaccine development and access would have been substantially greater. Glenn Elwin at the Dartmouth Institute is PI on a randomized trial comparing 2 online approaches for increasing COVID-19 vaccine confidence among long-term care workers, healthcare workers. A dialogue-based webinar or a social media website. It's a 3-year study. It's now in its 3rd year. Lindsay Leininger at Tuck is a health policy researcher who specializes in Medicaid and community health. As part of her community health portfolio, she co-founded and led a public education campaign during the pandemic that provided accessible and useful scientific information on social media. Vaccine education was a cornerstone of the campaign's content, continues to be a priority focus for the all-woman team of what she calls, get this, nerdy girl. Nerdy girl scientists and clinicians have evolved the campaign into a nonprofit science communication organization.